So let's begin with day 21 of Ellen's keynotes study streak. And those who are, you know, watching this in the last 21 days, I I totally appreciate and thanks you for being there as a part of this interesting, study streak, because it's not easy to continue something which is which is a regular routine, which is consistent, which is dedicatedly uh, to be done day in and day out every single day. And if you are the one who have been a part of these sessions and you have finished all 21 days either by watching them later on, or you know not attending live but seeing it later on, or hearing it later on when you are on any portal like Instagram, Facebook, YouTube, or Spotify, I say that it's a big achievement, because doing something consistently for 21 days gets you into the habit of doing it regularly and doing it uh, every month, every year, and for months and months altogether. So this is like going to enrich your knowledge on a everyday basis. So let's take over the two remedies, which are chamomilla and cina. Quite contradictory, quite opposite, but it's going to help us a lot in our practice, not just in cases of children but also in adults. So let us see how. The first thing with what we see for chamomilla is mentioned as oversensitive from use and abuse of coffee and narcotics. So firstly, it is kind of really a great day for all of us, where we are all doctors, and the doctors are, we appreciate everyone, each other of them. And it's a doctors day in India, so that's what we uh, celebrate. So Dr. Priyanka Madan, happy doctors day. And to all the other colleagues who will be watching this later on, who are live right now, wish them uh, a happy doctors day. So let's proceed with the two remedies. There is usually some spam attack which happens on the YouTube channel, and that's why I was just clearing it up. So there are suddenly some chat messages which are really irrelevant, and I had to remove them. So chamomilla is a remedy which is given to patients who are oversensitive from the use or abuse of coffee or narcotics. Persons, especially children with light brown hair, nervous and excitable temperature. So if you see that there is something mentioned about the temperament, and it is an excitable temperament. So the least thing is going to kind of touch them and stimulate them. That is what happens when chamomilla uh, is visible in our clinic. They will be angry on little things, they'll be spiteful on little things, etc., etc. Then we have further peevish, irritable, oversensitive to pain, driven to despair, like the remedy coffea, snappish, cannot return a civil answer. So you have someone who is like rebellious, who will be opposite of what the parents tell, or even adults. They do adolescents, or adolescent children, or children who are grown up enough, or adults who have still not left the chamomilla state and who are still going back into this phase again and again. And people have these phases of landing into a remedy and coming back, landing into a remedy and coming back. So there will be a phase which is going constantly. It can be a phase of calcarea, it can be a phase of thuja, it can be a phase of sulfur, which is on the background as a as a foundation, and it will have various stimulus because of different situations, and then their reaction may change into some other remedy, or it remains the same as that of the main remedy. So it depends on the homeopathic physician to elicit that and pick up and give them. So chamomilla will be suitable for patients who are peevish, who are irritable, who are oversensitive to pain, and they cannot return a right answer to the person who is asking them a question. Then we have the mention that child is exceedingly irritable, fretful, quite not only when he is carried, impatient, wants this or that, and becomes angry when refused, or when offered he becomes angry, and he petulantly, even if it is offered, he will reject it, petulantly rejects it. So this is like the remedy we read in bryonia, cina, and creosote. The child is too ugly to live, cross and spiteful. So someone who is spiteful means that he is uh, rebellious in nature and fights with the opposite person uh, anytime at the drop of a hat. Someone who is very angry at the drop of a hat, we think them as belonging to Nux, but chamomilla can also be thought for them very strongly. So let's see how we can think about uh, chamomilla for them. Piteous moaning of child because he cannot have what he wants, whining restlessness. So whining restlessness means that they are always desirous of having something in their hands or to do something, and it will be a kind of a nagging. It will be something which is, it gives a rise of emotions in your own self when you see the child. So when the parents complain, when the relatives who bring the child complain that this child sets me on nerves, that is the time we should think of the remedies which are inclined to cause a behavior which is of similar nature. Patient cannot endure anyone near him, is cross, cannot hear to be spoken to, averse to talking, answers peevishly. The other remedy which was mentioned in cannot bear to be spoken to was silica. But silica has something else, and that is when we are kindly speaking to the child, that time the child will react. Whereas antim crude is a person who will not bear to be looked at, and chamomilla is a child which again is similar to antim crude, like he cannot bear to be looked at, but you can calm him down, and then he will have a feeling, he or she, the child, will have a feeling that he wants something. If not given, he will reject, or if given, he will ask for something else. Give me this also. Okay. And now, what we see in Ellen's keynotes, there is a mention that there is patient cannot endure anyone near him. Now there is not a mention of child. Whatever were related to the child symptoms, children symptoms, pediatric symptoms, they have been mentioned in other line. But here it is mentioned that it is about a patient. He can be a grown up, adolescent, teenager, adolescent child, or adolescent, children who are in school, or graduating, or it can be someone who is much in their middle ages, but they are so much angry, they are so much snappish, that at the drop of a hat they will become so angry that they cannot have anyone around them. Then again we go back to the symptom where there is mentioned that children which are newborn and during the period of dentition, they require this medicine, complain from anger, especially chill and fever. Now, many times in our clinics, I was discussing about gelsemium just a couple of days back, and I don't know how many of you attended, but if you have attended, you will see how beautifully I had resolved a case of child who had fever just because she landed up in her relative's place. It started from emotions. So to elicit emotions and aggravation or causation from emotions from the patients is a very tactful ability you will develop over time. It's not that the you you only that senior who has shown the case in the in the seminar, or who is showing the case in the webinar, or anywhere else on social media, only he can do it. You also all can do it, but you just need to develop your powers of observation, number one. Number two, your ability to question and find out from the patient about why is it happening, how is it happening. Once you become like a spy in interrogating the patient, you will have more better chances of success in clinic to handle such patients. Otherwise, if you remain laid back, there is no chance that you will be able to reach that level where you see all the different speakers or different teachers or different stalwarts. So you need to develop these abilities to elicit emotions from the patient, and if it has caused chilliness, fever, different symptoms like toothache also, you will have to elicit. Pain becomes unendurable, drives to despair, aggravated by heat, aggravated evening before midnight, with heat, thirst, fainting, with numbness of the affected part, and irritations aggravate. Now consider if you are in a clinic and you get a case of a lady who has numbness of some part of the leg, and the patient comes to you with that complaint. She has not yet shared any of her history. For numbness of part, you have lot of remedies, like 500 remedies. The patient has pain in another part of the body or same part, but it is very unbearable. She says that I cannot bear the pain, just give me the painkiller and then I'll feel better. It is so much unbearable. So you have the numbness of the part, you have the unbearable feeling of the pain. Third thing about nature, she will tell everything is fine. I'm so happy-go-lucky person. At home, I manage everyone so beautifully. I stay in such a nice environment with everyone. I try to gel well with everyone. But if there is a relative who has come with the patient, you will ask the relative about how the nature is, and she is very angry. She will get angry at the drop of the hat. She will react too soon. She will react so fast. She will not think what the opposite person is thinking. So that's where you will have traces of chamomilla oozing from the case. There is numbness of some part, there is pain which is unendurable, and then the third component we have is someone who is peevish, irritable, angry at least small things. Those components will bring together and make the case of chamomilla. If at all the patient's relative has not come, in those cases you will have to examine the patient from different angles by asking them about physical generals or physical particulars, and maybe you will get that there is hot perspiration. Hot perspiration is usually a very characteristic symptom of chamomilla, and I learned this from Dr. Sunil Mosaka. So again, you have over here something which is having pain and numbness of affected part, oversensitiveness to open air, great aversion to wind, especially about the ears, sleepy feeling but cannot sleep, belladonna, causticum, opium. Other remedies. One cheek red and hot, other is pale and cold. Toothache, if anything warm is taken into the mouth, like the remedies bismuth, bryonia, coffea. Toothache on entering the warm room, toothache in bed, toothache from coffee, toothache during menses or during pregnancy. So toothache is a very big chapter. Clark has written an entire repertoire on it. And if we are to investigate and find out how toothache can be cured, we'll need to examine all the possibilities of cause, modalities, aggravation, amelioration, type of pain. Then probably you will reach to some areas where which will indicate some medicine for you. Then you have diarrhea from cold, anger or chagrin during dentition, diarrhea after tobacco, diarrhea in childbed, diarrhea from downward motion, borax and sanical are the other remedies. Stool is green, watery, corroding like chopped eggs and spinach, hot, very offensive like rotten eggs. So I spoke to you about how the perspiration is hot in the chamomilla patient. Similarly, we have diarrhea, which is also hot. Now, no one is going to touch the stools. So, how will you find that out? When the stools are being ejaculated or evacuated, you will see that it is having a very heat like sensation in the anal region, and that is where you will be able to pick up the traces of chamomilla. So, I think more attendees have joined. Dr. Parul, yes, happy Doctor's Day. And we are discussing chamomilla from Alan's keynote. So I hope if you have the book, you can read along. Going further, for the symptom convulsion, we have convulsions of children from nursing, especially after a fit of anger in mother. This is similar to Natsomika. Now, whenever children who are in the nursing period develop complaints, you will have to check with the mother about her mind, about her mental state, which is she is currently going through, and you will get some hint about how you will be able to, find out the relation between the illness of the child and the mother. And in most of the cases, like 60 to 70% of cases, you will find that either the mother is frustrated, she's angry about the situation in the home, about the current life situation, and the child develops a state from the mother. So in those cases, you have a prescription ready from following the remedies which have elements from so and so problem in the mother. Then we have a symptom. Actually, I missed the bracket, so let's go back to it and we see convulsions after fright in mother, opium. Convulsions after a fit of anger in mother is Nux vomica and chamomilla. Violent rheumatic pains drive the patient out of bed, compel him to walk about like the remedy Rustox. Now, when we see a mention of something about the GIT, something about the extremity, something about the female reproductive tract, it definitely means that this remedy has its scope beyond children. And when we see about these different symptoms, we should understand that these are the, these also can be the expression of patient when they are grown up or they have not left the chamomilla state. And for chamomilla, one of the very strong symptom is aggravation of joint pains or complaints of the extremities, especially at night or after midnight. So you have the next symptom which says burning of the soles at night puts the feet out of bed. The remedies, other remedies are pulsatilla, medorinum, and sulfur. And then you have a patient in the clinic who has burning of soles at the night or kind of a pain in the soles at night. When she goes down at bed, she is a very angry person reacts very soon, and this is what I have seen in my clinic. Patients will tell themselves also sometimes about anger, but we don't understand the intensity of anger because it is told to you in a controlled environment, and it is told to you uh, in compensated state. They are not uncompensated. When they go back home, when they go back to their natural surroundings where they are 99% of the time, they will probably react in a more wilder way than they have ever told you. So you will need to develop this ability to pick up these subtle things from the clinic, angry about trifles, about certain matters, laughing immoderately, awkwardness. These are the little things that you will pick up from your clinic in those few moments of case taking. Chamomilla has this kind of what do you say, uh, angriness about little things, peevishness, irritability, and also burning of the souls at night. So you see that there is a kind of a heat which runs through the remedy chamomilla, especially hot perspiration, hot diarrhea, hot feelings in certain organs, and there is hot feeling in the soles of the legs at night. Labor pains, spasmodic, distressing, wants to get away from them, tearing down the legs, press upwards, nipples inflamed, tender to touch, helonias and phytolacca are the other remedies. Infants' breasts are tender to touch. Milk runs out of breast in nursing women, and it's an excess in quantity. That's why it is mentioned. If it runs out after weaning off or there is no control over that part, then the remedy is conam. So then you come to the modalities where they say that there is aggravation by heat, by anger, evening before midnight, open air in the wind and air patients, amelioration from being carried, fasting, warm, wet weather. So you see, warm, wet weather is a amelioration factor. Chamomilla is complementary to belladonna. If you have a patient who is making a lot of noise, parents say that he makes a lot of noise in home, we can't keep him in control, he keeps on making noise all the time, but the child has come to you with complaints of head, neck or face, and it is mostly the cranial nerves which are affected, think about belladonna. If it is mostly the abdomen, think about chamomilla. In cases spoiled by the use of opium or morphine in complaints of children, think about chamomilla. Then you have something which is complementary or comparison of chamomilla, and the remedies are belladonna, borax, bryonia, coffea, pulsatilla, and sulfur. Not to forget the other complementary remedies which were mentioned throughout in chamomilla, especially number one was Naxomica, number two was Medorinum, which is a very good remedy for patients who have burning in soles. Here also we see it, and then we have something which is opium also, which is also very similar to chamomilla, except that there is a diametrically opposite polarity, which is dullness or drowsiness or sleepiness, but the physical levels complaints will be mostly same, and patients will come to you, they will start staring about their physical complaints. So you should have the ability to take up the physical complaints and take it as an entry point and delve into the mind symptoms, because it's not an easy job being a homeopath to uh, do many things at a time. You need to understand the case, you need to understand the diagnosis, you need to decipher or unlock the mind, you need to unlock the physical generals, particulars, understand whether the patient is in constitution or he has an acute exacerbation or he needs an intercurrent. There are so many things that you need to do, and the only way to master is to develop mental calmness and be at peace with what is happening. So we finish chamomilla, which is a very nice remedy for patients who are very angry, peevish, irritable, and they do not have mental calmness. So it's the exact opposite of what a homeopath should have, right? So let's move to another remedy, which is cina, which is a very similar remedy. So all those who are joining new, you can just tune into your Allen's keynotes on your desk. It is the major book that you should always have. So cina, you have Sina who is adapted to dark children who are with dark hair, very cross, irritable, ill-humored, want to be carried. but caring does not give relief. So you have children who keep on crying in spite of them being carried at the mother's arm or father's arm, and if they are still crying, either they want something they have not been given. It can be a chamomilla state, but they'll get quiet for a while and then they get weepy very soon. Think about Sina. Mainly, you should think of Sina when it does not want to be touched. It will not allow anyone else to go closer to him or her. Then we have someone who cannot, uh, you know, like caress from anyone, does not want, good feelings or good touch from someone. And if he or she, the child asks for certain things, he will reject it. Now, this is a state which is mentioned for children, and we usually look for smaller children who have these states, but it is currently, I would say, in the last 10 years, it is a state which also belongs to a lot of teenagers who have developed an ability to ask for the fancy toys and the mobile and the gadgets for their use, but they are not given, and they develop a cina or chamomilla state. So you need to understand that. Let's see what are the remedies in comparison. It's very clear: antimtart, bryonia, chamomilla, staph. So you see how beautifully, if you go and read clearly about chamomilla, there was a mention of antimcrude somewhere, or you feel that there is an antimcrude state. Whereas here you see there is an antim-tart state. Now, why is this useful? I'll come to it very soon if you are along with me till the end of this session. So, going further in Sina from Allen's keynotes, we have canine hunger, hungry soon after a full meal, craving for sweets and different things, refuses mother's milk, constantly digging or boring at nose, picks the nose all the time, rubs nose on the pillow or shoulder of the nurse. Like the remedy Tucamaram. So you have children who always keep on picking and boring their finger in the nose. They usually have worms. This is what the old school practitioners, the allopathic practitioners claim, and give them the worm medicines. Give them Sina, they'll be much better, and they'll also remove the habit which they have developed. Next, we have for Sina in Allen's keynotes, face is pale, sickly white, and bluish appearance around the mouth. Sickly appearance is mainly looks like he's very sad, dull, and he does not he doesn't seem to be healthy, with dark rings around the eyes. One cheek is red and other is pale. Like the remedy chamomilla, it's very similar in physical appearance, but the only thing in chamomilla is that there is hot perspiration. Okay. And in chamomilla, there is more of gastric involvement, whereas in Sina, you will see there is more of respiratory involvement. So now you see how over there was antim-crude or traces of antim-crude that we could see in the case in the materia medica, whereas in Sina, we see the traces and elements of antim-tart, which is belonging to the respiratory system. So you have in Sina, cough is dry with sneezing, spasmodic gagging in the morning, periodic, returning spring and fall. So there is someone who is, kind of having this cough every morning, and it is kind of a gagging cough. They cannot breathe. I have tried to give Campsina to many such patients, whether they are children or young adults or middle-aged people who have cough in the morning, especially as soon as they wake or in the period between waking and breakfast. And the cough is more of gagging cough, which cannot be brought out. It is just struggling to come out somewhere, and you feel that you will give causticum to that person. But think about Cina in those cases. Causticum usually has night aggravation or only at night or lying down aggravation. Then you have child is afraid to speak or move for fear of bringing on a paroxysm of coughing. So there is such a big fear that if he or she moves or you know does any activity, there will be an episode of cough, and this is what terrorizes them, and they don't talk or they don't want anyone to be near them because Any reaction from them will cause that cough, will cause that symptom from them which will trouble them. That is why you should think of cina. Children suffering from worms, pitiful weeping when awake, starts and screams during sleep, grinding of the teeth, and ascarites. The other remedies mentioned are cicuta, spigelia, and nux vomica. So you have children who develop worms. Think about cina as the remedy, and you will get very good success. Then in urinary system we have urine which is turbid when passed, turns milky when semi-solid, turns milky and semi-solid after standing, after it stays for a while, and it is white and turbid, and also sometimes they have involuntary passage of urine. So consider someone who has uh, involved nocturnal enuresis. They are a very angry child the mother has brought to you, but he also has recurrent URTI and he has cough mostly in the morning. So you connect these components and then you come to the remedy Cina. You will not get a perfect picture, or picture perfect Cina in your clinic, or picture perfect chamomilla in your clinic. You'll have to connect these different components in different areas and bring it together. Now if you see the relations, you will see the remedy very beautifully explained. First comparison is antim-crude, antim-tart is the second comparison. Bryonia, chamomilla, creosote, silica, staph in irritability of children. In pertussis of adults or young children or anyone, if you have given Drosera and that has not helped, think about Sino. This is going to help you a lot. This remedy Sina has cured aphonia from exposure to cold air or cold winds after aconite, phosphorus or spongy have failed. So consider this as a third or fourth level remedy for the respiratory tract after your initial remedies have failed. You can think of it as a first remedy also, provided the symptoms match more clearly, more individualistically. And when you have given uh, different remedies to adults in certain epidemic cases of cough or fevers, think about Cina as the remedy for children. It is going to help a lot in certain seasons or certain epidemics. If Cina is indicated in worm cases but it has failed because of some reasons, maybe the patient's vitality did not accept it too soon, your potency did not work, you can increase the potency but still not working due to some reasons, think of santonin, which is actually a component of the Cina remedy. And the other remedies you should also think of in cases of worms are Teucrium marum marum and Spigelia. So that's it. Today we have covered two remedies, which is Cina and Chamomilla, and it was day 21 of Alan's keynote study streak. And very soon we will finish the entire Alan's keynotes, all the related remedies which we are discussing. Maybe tomorrow we should discuss Drosera if it is there, and Spongia. So this is Alan's keynote study streak, and I hope if you all are attending this session, uh, there is something which is not just Alan's keynotes which I am reading as it is, but I am sharing something which is more indicative of practically useful in practice. So that's it from me. See you all tomorrow at the same time, and stay inspired and keep inspiring.